This is a short, informative PowerPoint on the Affordable Care Act, also known as Obamacare. We are occupational therapy graduate students at Indiana State University. So the first thing we'll have you do is to copy and paste this link into your browser. You can pause the webinar and take the quick quiz to see how much you actually know about the ACA before going through this PowerPoint.
Our mission statement with this webinar is to provide a basic knowledge and understanding of the Affordable Care Act by providing comprehensive and factual information to enhance understanding to healthcare providers.
Here are some of our learning objectives. We want to provide a basic understanding of the Affordable Care Act, also provide a brief history of the legislation of the bill, provide just an insight into what's to come in the future of this bill and what's changing, also to explain how it may positively, also negatively impact occupational therapy to remain neutral, and then also its strengths and weaknesses of the bill entirely.
We listed a few of the key points in the legislative history. It was introduced to the House in July of 2009 after Barack Obama was elected president. He later signed it into law on March 23, 2010. In June of 2012, the Supreme Court ruled that it is constitutional. And then some other key dates are January 1st, 2014 is when most of the ACA requirements went into law. So everyone had to have health insurance at this time that met the minimum requirements. You weren't able to be grandmothered into the program anymore. And then in January of 2018 is when everything must cover preventive care. But in March of 2017, the GOP was trying to have it changed, but they abandoned their efforts at this time to have it changed.
What is the ACA and what is its purpose? The Patient Protection and Affordable Care Act, also known as Obamacare, is a landmark health reform legislation passed by the 111th Congress and signed into law by President Barack Obama in 2010. The purpose of the ACA is to extend coverage to millions of uninsured Americans and implement measures that will lower healthcare costs and improve system efficiency and eliminate recession and denial of coverage due to pre-existing conditions. So who benefits from the ACA? Individuals who have lower income and cannot afford other insurance policies are able to participate and take advantage. It is needed to fill in current gaps in coverage for the poorest Americans by creating a minimum Medicaid income eligibility level across the country. The law includes premium subsidies and cost-sharing subsidies designed to reduce costs of coverage for Americans who qualify. The purpose of today's presentation is to educate occupational therapy professionals as well as other healthcare providers on the Affordable Care Act and the ever-changing laws and regulations regarding healthcare.
So now we're going to talk about the ACA regulations. So starting in 2014, you must have healthcare coverage or you will be required to pay a fee. The healthcare coverage can be one of many options, either public insurance, employer-sponsored insurance, individual policy, or policy through the marketplace. There are several exemptions for this. So if you are part of a religious organization, are in jail or prison, you are in hardship situation, which is defined by the Health and Human Services, an undocumented immigrant, you live outside of the U.S., you make too little to file taxes, cannot afford coverage, or a member of an Indian tribe. So if you fit under one of those exemptions, you are not required to have health coverage. The fee is currently $695 or 2.5% of the household income. So whichever of those is higher, whether it's the $695 or 2.5%, that's the fee that you'll be paying if you do not have health coverage. The penalties for minors is half the amount of adults. So in 2010, pre-existing condition insurance plan PCIP program designed to make health insurance available to those who have been denied coverage by private insurance companies due to a pre-existing condition. So this is where if someone has a pre-existing condition such as diabetes or COPD, they cannot be denied coverage by a health insurance due to that. In 2011, an extension of dependent coverage for health adults was put into play, so young adults can stay on their parents' insurance until age 26. Also in 2011, insurance companies are not able to place a monetary limit on hospital stays or other essential benefits. In 2014, there was a requirement to buy health insurance, requirement for all Americans to buy health insurance or pay the fine that we just talked about. Insurers cannot cancel plans when policyholders are sick. There's also the healthcare marketplace, which allows businesses and individuals to compare plans and enroll for coverage. So basically, it's like a shopping mall of insurance, and individuals can look around to see what best fits them and the amount that they are able to pay. Medicaid eligibility expands to those earning 133% of official poverty level. Tax credits are offered to small business for compliance with ADA. So if you're a small business and you have the insurance for your employees, you'll be given tax credits. However, large businesses will be charged $2,000 penalty per employee for non-compliance. So those large businesses that are not getting health insurance for their employees will be charged $2,000 per employee. And employers cannot make employees wait more than 90 days for health insurance eligibility.
All right, here are some strengths of the bill. So the first one is insurance companies can no longer deny coverage due to pre-existing conditions like just stated previously. So they basically can't drop them or raise premiums if the beneficiary gets sick. Also, kids and young adults can stay on their parents' insurance until age 6, once again, like mentioned before, which is seen as a strength to many. So as of 2012, more than 3 million previously uninsured young people were added. So this increased profit for insurance companies, and they receive more premiums now from these healthy individuals. Next is that it requires all insurance plans to cover 10 essential health benefits. So this includes treatment for mental health, addiction, and chronic diseases. So without these services, many patients actually wind up in the emergency room, and those costs are passed on to Medicaid and therefore the taxpayer. And then the fourth one is that this bill slows the rise of healthcare costs. So slower healthcare costs, it does this by providing insurance for millions and making preventative care free. So this means people receive treatment before they need expensive emergency room services. In 2016, the cost of healthcare services increased 1.2% for the year. That's much less than the price increase of 4%, which was in 2004. And then lastly, it eliminates the Medicare donut hole gap coverage, or gap in coverage by 2020. So the donut hole is the coverage gap of Medicare Plan D, prescription drug plans, where you have limited coverage and pay more out of your own pocket for your prescription drugs until you reach the limit in the gap, also known as the donut hole. So once you and your plan have spent $3,700 on the covered drugs, defined as the total added together of what your plan has paid, your deductible and co-pays, then you fall into what is known as the donut hole or coverage gap. So this amount is $37.50 in 2018 as compared to the $28.30 in 2010 before healthcare reform. So the amount changes from year to year.
Some of the weaknesses that go along with this bill are, as stated earlier, there's a fine if you do not purchase or have insurance provided by a company, and it's going to be whatever is greater, the percentage or the flat amount. Another weakness is it increased coverage rates, cost for plans. This is caused because we have raised the higher premiums, and because we have more coverage, so the premiums had to go up. This also increased tax rate for some. It wasn't increased for everyone, but some of them did see an increased tax rate. People had to buy different and more expensive coverage when their company dropped their plan. So this is caused because a lot of companies are now were required to provide insurances for their employees when they're full-time. And so they would find ways around to not have to pay that expense. And one of those ways is businesses were cutting employee hours so that they didn't have to buy them their health insurance. So a lot of people were affected in their work life because the business didn't want to pay their insurance.
How does this impact OT? So I have a chart that is kind of a comparison side by side, and I will further discuss each bullet point. So the ACA expands access to healthcare in general as part of the expansion insurance. Must cover a variety of services. A qualified health insurance plan that is a plan certified to be sold on the health insurance marketplace. These benefits include mental health care, substance abuse treatment, as well as rehab services. The next bullet point, we'll see new models of OT delivery. The ACA promotes more team-based collaborative care, which are designed to reduce costs and improve care coordination. It also encourages OT delivery in the natural environment, such as transitioning individuals from nursing homes and hospitals back to home-based care. OTs will deliver better care with better outcomes. The current fee-for-service payment model is inefficient and expensive. Research shows that fee-for-service reimbursement produces uncoordinated care as well as sloppy care transitions, both which lead to unnecessary hospital readmissions and wasteful spending. With healthcare reform comes things such as physician quality reporting systems and stronger emphasis on evidence-based practice. This will be more beneficial and is better for the health profession as there can be more evidence-based practice. OTs stand behind the public health movement. So public health care is switching more towards prevention and population health improvement. OTs will play a key role in fall prevention, heart disease and stroke prevention, nutrition and physical activity education aimed at obesity reduction, and workplace wellness programs. So some of the negative impacts from the bill include cost that has not decreased for everyone. So many private plans were canceled because they could not comply with Obamacare. Those affected had to shop for new healthcare insurance plans and ended up paying more for a plan that did not include benefits such as maternity care and things like that. They also had some tax penalties. So if you're uninsured, as mentioned previously, you may face large tax penalties. You will see the amount when you file your yearly taxes. There are also shrinking networks. Many insurance companies made their provider networks smaller in an effort to cut costs while implementing ACA requirements, and marketplace uncertainty. Health insurance companies are canceling individual plans and hiking premium rates due to the unstable marketplace. Many counties have only one insurance option because of insurance cancellations and decreasing competition and increasing costs.
Okay, so where is the Affordable Care Act right now? So as we stated earlier, in 2017, the House announced its intent to repeal and replace the Affordable Care Act with what's called the American Health Care Act. This intent was denied. This was an action taken by our current president, Donald Trump. So there is currently still talk about repealing and replacing the ACA, but the actions are currently at a standstill. So the ACA is still in action right now.
Now we're going to discuss an example of how this ACA benefits an individual. Miss Turner is a 34-year-old that was diagnosed with tumors after being in pain for days. She was apprehensive to go to the ER as her job did not provide benefits or health insurance. After much reluctance, she decided the pain was too much to bear, and the doctors discovered her uterus was full of tumors. She was unable to pay for surgery. She went to many insurance companies for coverage and helped cover her surgery, but was immediately turned down due to her pre-existing condition. Once the Affordable Care Act was passed, she was able to get a pre-existing condition insurance in the surgery that she needed to get well. So this is just an example of how an individual benefited from the ACA/Obamacare.
Okay, so to keep it equal, we're also including an example of how it was a detriment to somebody. So these are two self-accounts from people, real-life people that just made comments about how the ACA or Obamacare really hurt their family. So first is from somebody named Fred T., and he's from Pennsylvania, and he's included in those that are self-employed. So he stated, I recently received my annual health insurance rate increase. My rates went up from $2,500 a month to over $3,750 per month. Last year's increase was devastating. This year's increase is even more overwhelming. I am self-employed and I liked the insurance I had only a few short years ago. This news is absolutely devastating to my family. And then next is from Kathy H. She's from Missouri, and she's representing those that are small business owners that are just feeling the negative effects of Obamacare. So she stated, as a small business owner, I recall the days before the ACA when we would receive a 2-inch notebook that contained multiple quotes from different health insurance companies. Now our options are listed on a single legal-sized sheet of paper. We only received 3 quotes for 2017, and just 2 of them were adequate for our region. In 2013, our insurance cost $180,000 for 92 lives with a $2,000 deductible. In 2016, we paid $252,000 for just 61 individuals who face a $5,000 deductible. Our options are dwindling, our costs are skyrocketing, and our employees are ultimately suffering because of the ACA. What can you do to stay informed? Here are just 2 websites that you could do to just get involved. One is the Henry J. Kaiser Family Foundation. It's a great website with just a lot of information to answer any additional questions that you might have, and a simple way to stay up to date on what's going on with healthcare in America, which we know is extremely important nowadays. And then the next is just AOTA, which is an advocacy and policy tab. So you can visit your National OT Association website to stay up to date on all healthcare information specifically related to OT.
Okay, so we're going to have you take the same quiz you took at the beginning. So you can pause the webinar and paste the link back into your browser. I just want you to retake the survey and see how much you've learned throughout our presentation. And thank you for joining us for our Affordable Care Act webinar. We hope that you learned enough to be able to inform your patients and inform other healthcare providers of what the ACA is and how it could benefit or not benefit you and your clients.
And then here are just some of our references that you could go to if you want to just learn more or just stay up to date.